Hey guys, it's Rich Severn, or P2 Reviewer. We're re-recording the live video that had been published earlier. The feed kind of got jumbled up, so I wanted to have a clear video for you guys. I wanted to start by saying that it was really uplifting, encouraging to see the conversation that came out of the student group regarding the Vitals Are Vital movement kind of catching on, and not just the hashtag, but the awareness of the importance of taking resting blood pressure and heart rate or vitals in general on every new patient at the evaluation. It's just awesome to see, especially in new graduates or students where I think are really going to transform their profession kind of going forward. This is that next generation. It is still kind of disappointing, though, that this is still an issue within our profession, as far as this perceived importance of screening, which translates into practice behaviors. Especially considering that 25% of the United States population has hypertension, which is the leading risk factor for heart disease, or as far as a modifiable risk factor. If you look at control, 50% of patients are effectively controlled. So it's even if patients are aware, which is not 100%, because hypertension is asymptomatic, even in super high degrees, it's asymptomatic. And it's especially concerning in younger populations where there's this perceived notion that young people can't get it, and they can, and the consequences of a lack of early detection can be drastic. But again, 50% are effectively controlled, so we can't rely just on looking at a chart or looking at their medication list, because they may not be controlled. 40% of patients stop taking their meds within their first year. It's again, this is something, it's a big issue population-wise. And early detection can result in, huge savings of costs. Hypertension costs us about $42 billion a year to treat in the United States. That's incredibly expensive. And a 10% reduction could lead to huge reductions in costs and burden to our healthcare system. But it also can result in a 10% improvement can translate to about 14,000 lives saved, from this, and a 10-tick decrease can translate to about a 13% reduction in all cause and cardiovascular mortality. So again, early detection is key, management is key, and management of risk factors that may play into this. Again, heart disease and hypertension, and if you look at why this is disappointing in PT practice, if you look at the risk factors for heart disease, physical inactivity, obesity, smoking, smoking and diabetes, these are almost identical to some risk factors, but mainly risk markers in patients for some of those common conditions that we treat as PTs: low back pain, knee osteoarthritis, hip osteoarthritis. Again, you guys can probably speak to this. You in your practice, you probably see patients with low back pain that may have hypertension or heart disease. Hypertension, is one of the leading causes of stroke. And that kind of speaks again to that. If you have, if you have a stroke, it's not like your other vessels are healthy. Usually, people with vascular issues have it profusely throughout their body. So again, these are things you're going to see in the clinic. And then you factor in disabilities. Patients with disabilities of various kinds have a higher risk for developing cardiovascular disease and hypertension. There's published data on this. We do a lot of this in our lab, actually, looking at patients with different developmental disabilities and how this may influence them. So again, this is something we can really address head on. But in addition to the increased screening and doing that, what I'd really like to speak about is why haven't we embraced this as a profession, as something we can treat? Again, movement is something that the name of the game of our profession. If there's class 2A recommendations across societies that suggest that exercise treatments for hypertension are beneficial, aerobic resistance exercise. If we talk about conversations for reimbursement with other insurance companies or physician groups, imagine going to the table saying, hey, like, I can provide you treatments here for your for hypertension. We can reduce the prevalence or at least improve the control of patients with it. You want to talk about revenue or lucrative businesses. This could be huge, in addition to all the things that'll be good for the patients and our communities. So this is something we really need, I think, need to start embracing, and why we haven't, I don't really understand why. This can be managed with a cash-based system. There are people that are already kind of doing this. In addition to the reimbursement, research, like, we should be leading in some of this research. If we really want to be the movement-based professionals, this is something we need to do. Like, we need to start embracing this again, because these are the patients we treat have this condition. It's a huge problem, and we can address it. So we are working on things, within our lab, with my lab group, of publishing guidelines, which will help raise the awareness of some of these issues and what's actually going on in practice. Guidelines, because a lot of conversations I get from clinicians, like, I don't know what to do. So we're publishing papers on that. We've made resources for the APTA. I'll include links for that. Always feel free to reach out, but keep the conversations going. And I want you guys just to think about, like, embracing this as a profession, as something we can treat. We can treat hypertension with exercise. We are the movement-based professionals. We are the movement-based profession. We really need to start thinking about transforming society by addressing the disease that burdens society the most, which is hypertension. So vitals are vitals, guys. Have a good one.